Hello, good afternoon, everyone. Welcome to yet another session of Doctors Go Live on Facebook. We are on Columbia Asia Facebook now, and we are going to be discussing about something that is very, very common among children. So parents, I'm sure you all can relate to this, yeah? Cough and cold among children. This is very, very common. But when should we start getting worried about their coughs and colds? Is it something that is that's irritating their throat, or is it something that is more than that? For example, an infection. To discuss this with us today, we have an expert who is Dr. Kenneth Looi, consultant pediatrician from Columbia Asia Hospital, Cheras. Hello, doctor.
Hi, Sakina.
Good to see you.
Yes, good to see you too.
Thank you so much for making time to talk to us today regarding our topic about common childhood respiratory diseases. Okay, so without wasting any more time, let's just go straight into, let's find out what exactly is a respiratory tract. Which part of the body is it? I understand that you've got some slides to show us.
Yes. I've made us some slides to show so that it will be clearer. Okay.
Okay, all right.
Okay, next slide. Okay, the respiratory tract actually starts all the way from our nose up to our lungs. So for classification wise, we actually divide them into the upper respiratory airway and the lower respiratory airway. So upper means anything out of the thorax. Anything out of our chest is considered upper. So the nose, then your throat, your tonsils, they are all and your vocal cords, the larynx, are actually considered the upper respiratory tract. So this is the tract that where most infection happens. Your normal cough, running nose, it usually affects the upper airway. So anything below or inside the chest wall is considered lower airway. So your main bronchus or bronchi, that anything that goes from the airway up to the lungs to the alveoli are considered the lower airway. So it actually is from nose up to the lungs.
Right, I see. And how often do these infections happen in children, and how long does an infection usually last?
It is actually very, very common. It's like bread and butter for pediatricians that parents bring children to see us. Most of the time it is because of this simple fever, cough, runny nose. So the good thing is that it's usually self-limiting, means that they do get better after a while, and it's very common. So if you're talking about children who has not gone to school yet, it's averaging about 5 to 6 times a year. But when you start going to kindy, or even those who are going to daycare very, very early on, they can go up to 1.5 times. That it can go to 7 times a year, and that is still considered normal. So the duration of this infection actually lasts about a week, 7 to 9 days before they actually fully recover. So very commonly seen, the parents come and say, I have been coughing for some time and it's not getting better. It's just these very common symptoms that parents bring to see me in normal days.
I see. So this sounds like something that is, because it's very common, it's something that parents should, not really crack their heads over, because it's just something that comes with being a child, for example. What are the particular criteria of children that would get these infections? You mentioned just now children in school. What are the other traits of?
Now we'll go back to, for easy classification, the upper respiratory tract and lower respiratory tract. Upper respiratory tract commonly happens in children more than 6 months old. So the earlier you join a childcare center or kindergarten or going to school, then the earlier you are exposed to viruses and more children, then it is actually a higher risk of getting upper respiratory infection. So at the same time as well, if you are sharing a bedroom with adults, parents are sleeping with their kids, so that increases the risk of having upper respiratory tract infection to the child actually, because we work and we see many people, so we might be catching some viruses and pass them to the child. But these are upper respiratory tract, as we were mentioning just now. It is actually quite self-limiting. But lower respiratory tract is the one that we are more worried about. So usually this applies to the group of children that are much younger, 0 to 5 months of age. Then they are usually more affected, and if they are really affected by a virus or infection, more oftenly goes down to the lower airway. For some reason, males are actually more affected. And again, if you are attending childcare center or kindergarten or daycare center much earlier, the risk is much higher. And one very
Right.
important thing is that passive smoking increases infection, lower respiratory infection, not really upper, but lower respiratory infection. So passive smoking means that if your parents are smoking and your baby is actually sleeping next to you, and they can smell the smoke all the time, that makes them a passive smoker. And this actually
Yeah.
increases the risk of getting lower tract infection. Another very
Right.
important thing is that if they're sharing a bedroom with children of 0 to 5 years old, means that if they're elder siblings that actually has been going to school and they are sleeping with them together, then that increases the risk for these babies to get lower respiratory infection. So most of the time you see parents, for the young, older ones, they actually get normal cough running nose. But for the baby, actually, it goes down to the lower respiratory and causes rapid breathing much more frequent. And
I
one very
see.
important thing that I would like to highlight is the protective measure. So the only thing that is very strongly indicative of protecting the babies from not getting these infections are breastfeeding.
I see. So that's another plus point of breastfeeding.
Yeah.
Excuse me. Talking about respiratory, suddenly I'm also coughing. Okay. Just now you mentioned about smoking, passive smoking,
Mm.
and how it can
Mm.
increase the risk of a child getting
Yes.
respiratory infection.
Mm.
When we talk about that, does this mean that when, for example, somebody is smoking in the room and the child is in the
Mm.
room, or somebody from outside who was smoking comes back into the room?
Mm.
Because some parents are quite wary even when the smoker is not smoking, but because he smells of
Mm.
smoke, does that bring any kind of
Yes. Yes.
any kind of
Yeah.
to
I always
the
ask
child?
them. Yeah. I would, when the parents are in my room, I always ask them, Mama, if your husband doesn't tell you that he's smoking, do you know that he's smoking? All the time, when they walk in, we know they're smoking already because
Yeah,
I just
yeah.
very sensitive to the smell as well. So, but that's the thing, even if you're smoking outside of the house, but as long as you're smoking, then the smoke lingers around you. So when you're
Correct.
feeding
Yes.
your baby becomes a passive smoker immediately. So I always tell
Oh,
the parents, okay, we can't be discriminative, but I tell them, whoever that is smoking, if you really can't stop smoking, you smoke outside of the house. The moment you reach home, you shower, you change and everything, and don't touch your cigarettes anymore. Because if you still smoke and you don't wash, the baby is still smoking smelling the smoke all the time, and that increases their risk of getting respiratory
yeah,
infection.
yeah. Yeah, because they feel that when you don't see the smoke, so it means that it's okay. But actually, because it
Mhm.
lingers, lah, like you said, it's still
Yes.
as dangerous.
Yeah. Yes.
Yeah, okay. What is actually that's causing these infections?
Actually, most of the time, it's actually a virus origin. Means that 90% of these upper respiratory tract infection are due to viruses. So it
Yeah.
doesn't really quite matter which virus because the treatment is about the same. But the most common virus will be those listed on the screen: rhinovirus, influenza virus, adenovirus,
Right.
RSV, and coronavirus. But
Yeah.
most of the time, it is actually virus origin. But if it's lower respiratory tract infection, then it is more has a higher percentage of bacterial infection. And of this bacterial infection, the most common is group A streptococcus. So what I'm trying to say in this slide is that to parents is that 90% of time is actually virus. So that is the reason why pediatricians will tend not to start antibiotics on very early on when we think that your child is having a viral infection, because most of the time it is so. Whether or not I give you antibiotics, it actually doesn't change. You will take about 7 to 9 days for your child to recover. So antibiotics not really recommended routinely in children having upper respiratory infection.
Just to clarify, antibiotics is only for bacterial infections. Is
Yes,
that
it
right?
only kills and yeah, antibiotics kills bacteria. Antiviral kills virus. So like antiviral,
Yes.
for influenza, there's its own antiviral. So bacterial, antibiotics does not kill, does not do anything to the viruses.
I see. Okay. Perhaps we can talk about the symptoms now because I understand that there are many symptoms,
Mhm.
and not all children will display the same symptoms. Let's take a look at your slides regarding signs and symptoms.
Yes. Okay. I think this will be very familiar with parents who have children. When they have upper respiratory infection, the most common the most common signs and symptoms will be coughing. Whether it's a dry cough, most of the time it's with phlegm, productive cough. Sometimes it's barking cough, like the very dry and very painful kind of cough. And there's whooping cough, which is not commonly seen now after the vaccination. You have running nose, You can have blocked nose together with a running nose, and sometimes they complain of sore throat, especially in older children, and many of times they have fever. And they usually tend to be a bit tired, malaise, and sometimes with the high fever, you do get a bit of headache, and the appetite is generally reduced. So, you can have one or two, means that you might have just cough and sore throat or just cough alone. But generally, these are the symptoms where you see when patients having upper respiratory infection.
Right, I see. And then, okay, all right. How serious can these infections get? Now, let's say if it is untreated,
Yes.
what are the complexities that can come with these infections?
Now, we mentioned that the upper respiratory infections are most of the time self-limiting, but if it's get bad and we don't really treat it well, so it can progress. When it progresses, it can actually bring complications, several complications. One of the way that you will go to spread is through, from the nose to the ears, because there's a tract that's the eustachian tube actually connects the throat to the ears. So infection over the throat can actually go up to the ears, causing otitis media. It can also from the nose go to the side here, causing sinusitis. Okay, ear infection can go to the back to the mastoid process and cause mastoiditis. And actually, if it's still not untreated or not treated well, it can go to the brain and meningitis. All starting from an infection of the throat. Okay, this is one of the pathways upwards. Okay, the second way is to go downwards. From the upper respiratory tract, it goes down to the lower respiratory tract. So when it goes down to just the airway only, just the bronchus, that's called bronchitis. When it goes down even further down to the lung parenchyma, then that's pneumonia. So when complications happens, usually that means that it is more serious, and we really need to start to do something.
That does sound very. I mean, that's something that would make parents really wary, and it's just a reminder that whenever a child coughs, and if it extends more than a week, what you say, based on what you mentioned just now about the number of days that the child can suffer this cough and cold,
they should be progressively getting better. So if they are not getting better throughout, they should be progressively getting better from as the day goes by. But if it's not, then it's a sign that you should see a doctor. So I also talk about bronchiolitis and also bronchopneumonia, because it's very common, and we're talking about respiratory infection today. So this slide is about bronchiolitis. Bronchiolitis means the inflammation of the bronchioles. Bronchioles is the smaller air passages in the lung. So you have a main bronchus, then it's divide some more. So when you go down to the lowest part, it is called the bronchioles. So this infection, bronchiolitis, actually occurs very commonly and almost specifically for younger children less than a year old. You don't get bronchiolitis after this age most of the time. So, but the peak of this bronchiolitis is at about 3 to 6 months old. So the younger it is, the higher the risk when they have an infection over the throat. It can go down to the bronchiole, causing bronchiolitis. Now, most of the time, it is viral infection. And the most common virus is actually the respiratory syncytial virus. Okay, the symptoms are some of them are what we have mentioned just now. They have fever, they have running nose, nasal discharge, nose block. They might be coughing, and a lot of times they have wheezing because they have gone down to the airway. The airway actually gets constricted, and that when they breathe, you can hear this wheezing sound. If it's really bad, they get apnea. Apnea means that they stop breathing for a while. They will cough, until the face turns red, and then they actually stop breathing for a while. So certain infection, you see that. So RSV bronchiolitis actually gives you this sort of symptoms. And when they are having fever, a lot of phlegm, they are crying, they're not comfortable, feeding is usually poor. And in kids of this age, when they are not feeding well, they get dehydrated pretty soon. So a lot of times we get to see bronchiolitis coming in with very poor feeding and very fast breathing. Now, treatment-wise, it's actually supportive. Supportive means that we don't have an antidote for RSV. I don't have an antibiotic to kill RSV, but we do know that you need to support them. When they're having fast breathing, you need to help them with their breathing, giving oxygen, giving nebulizer. Too much of the phlegm, too much of secretion, then we do suction to remove those phlegm, and give them drips if they're not feeling well. Okay, the next slide actually shows what happens inside the bronchioles. Now the
Okay.
one on my left, which says that the normal bronchial, that's normal. Okay, when bronchiolitis happens, you actually can see the airway being constricted here, constricted, and then there will be actually phlegm, the yellow color phlegm blocking the
Yeah.
airway. So from an airway like this, it becomes a very small airway that makes them very difficult to breathe. So that's why they are breathing fast, extra fast to compensate for that.
Yeah. Does this have anything to do with asthma?
No. Bronchiolitis is an infection. You know, it doesn't mean that if you get bronchiolitis, it increases the risk that you're getting asthma. It's two different things.
I see.
Asthma means that your airway is sensitive. Recurrently, you get recurrent wheezing. So if just one
Correct.
episode of bronchiolitis does not mean that you have asthma.
I
Yeah.
see.
So the next entity from the next slide is actually bronchopneumonia. Okay, bronchopneumonia, as we mentioned just now, it's even lower down to the lung parenchyma at the alveoli. So this usually result from an infection acquired from the community. You know, other people coughing, running nose, and pass it to the baby. So more common in children less than 5 years old, and the symptoms are similar. You know, they have high fever, cough, running nose, fast breathing, and they have this chest wall recessions. So most of the time, it can still be virus, but it has a higher percentage of getting bacterial infection. So bronchopneumonia most of the time requires antibiotics. So the baby who is lying there, you know, you can see below the rib cage, you can see a line here at the
Yes.
rib cage below the, because these are called recessions. You know, when you see that, means that the baby is using extra effort to breathe. So this is never normal. So any parents who see this should bring you to see a doctor immediately.
Okay. What are the recommended treatments that you would administrate to your patients who have these infections?
Now, upper respiratory tract infection, as we mentioned, was viral infection. So
Yeah.
actually, antibiotics not recommended unless they are really really unwell and there are other signs and symptoms that shows that there is bacterial infection. So,
Yeah.
but most of the time we don't recommend antibiotics. We give supportive treatment, which we will discuss in the further slides. But bear in mind that the normal duration of this infection is 7 to 9 days. They will get better. They just need a little bit more time. Okay. So after
Okay.
this, I will be talking about these slides. The subsequent slides are about the signs and symptoms, each and every sign of symptoms.
Okay.
The treatment, what are the myths that parents are worried about. Okay.
Okay.
First one we're talking about will be fever.
All
Now,
right.
now you must measure your temperature. I think that's the normal norm. Everyone is very used to being checked temperature. But it's very important. The thing that some parents will tell you that dia rasa suam-suam lah, macam panas sikit lah. Tak ambil temperature. It's a little bit difficult on my side. So fever or no fever. So very important, please do measure the temperature. I'm not saying that the higher the temperature, the more severe the disease is. It's actually virus infection can give you similarly high temperature as well. But certain temperature trend, that high spiking fever for a few days, and a certain trend, gives us an idea what kind of infection it is. So it would be good if parents can tell me that how high the temperature is, how frequent does the fever comes back. After I take medication, it never goes down, or after I take medication, it actually comes up for a good 4 to 6 hours, then it comes back again. So that will give me an idea how the child is doing. Okay, so the treatment of fever is as many parents will know that you give fever medication. Paracetamol, ibuprofen, and diclofenac sodium are the three medications that can be used for fever. So first time we usually use paracetamol first. It's safest at the correct dosage, and it's has less side effects. So we usually use paracetamol first. Okay, so another way of reducing the temperature is physical therapy. Means tap sponging, means that we are wiping the baby's body by using a damp cloth. So that can also bring down the temperature a bit. But do not do it. You don't have to keep on doing it the whole night, because that will disrupt the baby's sleep. And there are also studies that show that if you are doing it too long, then you get a rebound fever after that.
Okay.
Cough, another thing that it is very disturbing for both parents and also babies. So one of the most common coughs that they bring to see me. But then cough is actually a protective mechanism, you see. Why are we coughing? Because there's something at the throat. there are phlegm over there, there's some bacteria over there. Your body is trying to get rid of this thing, so that's why it's coughing. So it's actually a good protective mechanism, but it causes distress to both the parents and the child. So that is why we give medication to help to relieve the symptom, but we cannot and we do not want to fully eliminate it, to eliminate the protective mechanism. Okay, so now cough syrup, most of the time the normal cough syrup that is sedative, means that it makes the child sleepy, are only licensed to use after 2 years old. There are some medication, the 1 or 2 medication, most of them are herb-based, can be used in children less than 2 years old. But you talk to the doctor and make sure that the medication that's given is safe to be used.
Yeah.
Okay.
These are off-the-counter medication.
There are some.
On the shelf.
Yeah, there are actually. I wouldn't mention the brand, but there are 1 or 2 that is actually over the counter.
Okay.
Another thing is phlegm. Okay, so a lot of time if phlegm builds up, the reason why the phlegm builds up is because there's infection there. Your body is trying to, the reaction of the airway is to produce this mucus to trap the bacteria or the viruses. Then after that so that you can cough it out. Now, but the thing is, sometimes when it's too thick, then it's very difficult for the baby to cough out. It's just stuck there. Right. They can't cough it out. They can vomit it out. So it makes cause significant distress to the baby.
Correct. So, yes. Even to the parents, it's very distressing actually to look at the baby in that condition.
Struggling, breathing for air. So what we can do is actually there are medication to be taken to either make make it less thick, to reduce the viscosity of the phlegm, so that it's easier for them to either swallow it down or cough it out. Or there are some medications to really, to make you cough harder, so they cough out the mucus, which I rarely use. I usually use more of mucolytics to make it less thick, so that it's easier for them to either swallow down or cough it out.
Right.
But of course, you must drink. If they are dehydrated, their body have not enough water, then actually your mucus is going to be thick. So oral hydration is actually helpful. Mist therapy is a bit controversial. Now, for younger children, I don't quite use.
What therapy is that?
Mist therapy. Means that
I see. Yeah.
And then you have to put something in hot water, then the mist come out. Okay, the next one is running nose and nose block. Yeah. Okay, running nose. We use antihistamine to treat running nose and also nose block. You can take, if it's running, if it's like the running nose is not blocked, then you can take oral antihistamine. But if it's blocked, then we sometimes use nasal spray to unblock the nose. There are also saline nasal drops or nasal irrigation that we can use as well. Now the thing is, with younger children, when the nose is blocked, they are babies less than a year old, their nose breather, they breathe better with their nose. So if the nose is blocked with secretions, then it's very difficult for them to breathe and also to feed. So what we can do is actually using saline, saline nose drops or saline spray to help them to remove to flush out the what do you call that, the phlegm or the humus inside the nose. Yeah. Okay, next slide.
Okay, all right.
Yeah, I'm sure most of parents will have seen the some video on Facebook or any social media that you can see, parents using this syringe filled with salt water and flush it into the nose and it actually wash out. Yeah. It actually does work, Now you can actually use salt water to flush it into the nose and it actually wash out the any phlegm or anything that's blocking that, and that they can actually breathe better and they feel better. But the thing is, with the flush, it's actually a bit more strong and hard, not so gentle. So in my practice, I prefer to use this sort of nasal spray. Similar thing is sea salt water. It doesn't contain any medication, so you can actually use it as frequent as you need to actually you spray it in so that it wash out and flush out from the nasal secretion from the other side, and baby can.
Yeah, and you just need a syringe for this.
Sorry.
You just need a syringe to do this?
You can use the syringe, but there are some products like the one the baby is using. There are some products like that you can actually just spray it from the bottle. So those I use those more often actually. They are gentler.
Yeah. I can imagine a 2-year-old struggling when you want to put anything up the nose. I mean, already if oral medication, they'll be going crazy. This is something
Yeah,
to be put up their
most of
nose.
the time, if they are older, then they can understand that doing that they feel better, then they
Mm,
might cooperate. 2 years old is a bit
yeah,
tricky. Okay,
yeah.
so this slide is just to show that if your nose is congested with a lot of secretion, then the by washing it, then you can washing it away, flushing it away, then you can regain some sort of like healthy nose that you can breathe better.
Right.
Okay, next slide. Sore throat.
Sore throat.
Although older children sometimes complain of sore throat, we do experience sore throat also when we have upper respiratory infection. So most of the time it goes away. It goes away, but there are some things that some medication that we can use. The simple soothing remedies like Linctus, hot tea with lemon, honey lemon, lozenges actually helps a lot. We can also use topical anesthetic agent. Um,
Yeah.
but the gargles, the child must be able to gargle. If they are, of course, they are not meant to be swallowed. So if I have
Yeah.
doubts that the child might not be able to gargle well, I will not recommend that. Another thing is the diclofenac sodium drops are also quite useful in reducing the pain at the throat.
Okay.
Okay, next slide.
Traditional remedies.
Yep. Yes. Many a times parents will, there are many traditional remedies. I'm sure you, Sakina, have heard of some from our parents.
Yes, yes, that's right.
Whether they
Honey,
work.
lemon, and all those things.
Yes. Do you use honey lemon?
Honey lemon I use for myself. But
Yeah.
for children, I can't remember using any of those when my children were young. I remember
I think.
slightest cough, I'll just go straight to the doctor. Maybe I should just
Okay.
have tried these traditional
Yeah.
home remedies first.
Actually, the
What?
traditional remedies, I would just want to put, to highlight honey, because honey
Mm.
has been extensively studied in many big studies and researchers, and actually it shows that actually it's very helpful. So
Yeah.
if you are taking a glass of warm honey before sleep, it actually
Mm.
reduces the cough, phlegm, and also increases the
Oh,
quality. But
I
the
see.
only thing to remember is that do not give honey to infant less than a year old, because it increases the risk
Mm.
of infantile botulism. So, because the thing is, honey is a dietary reservoir of this Clostridium botulinum spores, in which if it's infected, then you can get this infantile botulism where it affects your muscle, and very severely if you affects your respiratory muscle, you can't breathe. So it's very unlikely to happen in children less 1 year and above. So 1 year and above, safe to use honey. 1 year and below, avoid honey. Wait for them to go out. But it has very good evidence to show that honey, when
Mhm.
given at night before they sleep, it actually improves the quality of sleep for the child.
Oh, I see. Good.
Yes. Mm.
Do we have anything else apart from honey?
Yes.
Oh, okay.
Um,
All right.
yes.
These are
Recommend.
supplements.
Yes, many a times parents are asking doctor any supplements that I can give to
Mm.
boost the child's immune system, to increase the child's immune system. Now the thing is, the immune system, it's very difficult to measure how good your immune system is. But
Yes.
there are some, of course, there's some studies that shows that if you're taking vitamin C, if
Mhm.
I mean by right you should be able to get vitamin C from your normal
Mm.
dietary. But if your child is very picky and they're not taking enough fruits and
Mm.
vegetables, so you are worried that you are lacking in vitamin C. Vitamin C does actually helps in terms of reducing the symptoms by
Correct. Yeah.
if
Mm.
you're taking it during the cough and running nose, it reduces the symptoms of cough and running nose, and they sort of like recover earlier.
Yeah.
The zinc supplement also have a similar effect that shows in the studies. So I think in the market there are some zinc, vitamin C and zinc formulation together that can be given
Mm.
for children for like supplement for daily basis or only when they are having fever. That is also possible.
Wow.
Echinacea is
Okay.
very, yeah, echinacea is very commonly used in the European countries, not so common here.
Mm.
But there are some studies that
Mm.
shows it helps in terms of
What is it
reducing.
actually? Is it a herb?
Yeah, it's a herb. They have this
Mm.
formulation, the syrup form or tablet form, not so commonly seen here. But if you go into the
Mm.
research and studies, there are many studies in the European countries that they have
Yeah.
shown that it's sort of helpful. Mm,
Oh, I see.
yeah.
Okay. Anything else after this? Okay, all right. Thank you, Dr. Kenneth. Okay, I've got some questions based on our banter just now. There are also some. I know that I remember doing this when my son was a lot younger and he was suffering from all these stuckness. We would go to the toilet and turn on the tap, hot water, and let the whole toilet steam up and just stay there
Yes.
for a while until the steam clears his breathing. It seemed
Yeah,
to work slightly
can
better.
be used. Can be used. It actually helps because if the air is cold, actually it causes the secretion more or it blocks the nose. So when the room is a bit warm, then actually helps in terms of reducing the symptoms actually.
Okay. What about because people are quite crazy about essential oils these days. So I think they've been using peppermint oil in diffusers, and they switch on these diffusers like at night, especially while the baby's sleeping, and it seems to work as well. What's your opinion on that?
Well, I've been trying to find, but I can't find any good research. I mean, it doesn't show that it's harmful. It doesn't show that I also do not find strong evidence that shows that it's it's useful or safe. So it's very difficult to comment on this stage. I won't stop
Understand.
using it, but I won't recommend using it as well because I can't find strong good evidence.
Understand. Yeah. Okay. What are the remedies are there at home? Just now we spoke about oral remedies, like we spoke about honey, and then vitamin C. I suppose fruits would also be included in that.
Basically, when they are unwell, they are not drinking and eating much. But of course, in order for them
Yes.
to recover, getting adequate hydration is very important. You
Yes.
have to have adequate hydration. You must at least drink enough milk or water. At the same time, they need nutrition. You need nutrient. So they need to sort of try your best to get them to eat a bit. Because if they are not eating much, that's the time that they don't have the strength or the immunity to fight the infection.
Yeah.
Yeah.
Maybe you can share with us some tips about how to get a child to eat when a child is, feeling under the weather, especially when it's hard to breathe and coughing.
Basically, first to have to make them comfortable. I mean, as comfortable as we can first. So
Yes.
the thing is, if there are nose block, mainly if the nose block, they would be, they can't breathe through their nose, so it's very difficult for them.
Yeah.
So medications like oral antihistamine will help to reduce the symptoms, but again, you should use you should use nasal irrigation or sea salt to wash the nose before feeding, so to clear clear the nostrils so that they can breathe better than only feed. So I always tell parents, your the appetite is not going to be normal. We don't get them to eat as normal, but you
Yes.
don't want them to not eat as well.
Correct.
So at least have some a little bit of milk, a little bit of porridge or small food like soup or anything that actually helps to get them to feel better. One thing
You
that
mentioned just now. Sorry, say again.
yeah, another
No,
thing
okay.
about I was thinking about another thing that parents usually do ask me frequently about that they're always worried about is the fever. Yeah. So many times they are thinking, doctor, I'm so worried it's 40 degrees Celsius. So I rush to the emergency room. So I rush to a clinic because it's 40. So when should we worry about this fever? When are we worried about this high fever causing damage to the brain, which is most of
Yes.
the worry of parents. Now, I always tell parents, we must understand what is fever first. Why is there fever? Fever is a physiological response of our body. Our body, when there's an infection coming to our body, when our immune system is fighting it, then fever occurs. And when your body is having a slightly high temperature, your immune system is actually more active. So sort of like your white blood cells are better, are more active in terms of fighting the infection. So it is actually a good thing. But why, doctor, you're saying that it's a good thing. Why are we giving fever medication then? Now, fever medication, the only thing that the fever medication do is to reduce the fever. It does not do anything towards the infection. So if there is an infection, the body still has to fight it on its own. But we are giving fever medication because we want to make the child comfortable. So you see, a lot of times when they are having fever, they are not feeling well, they're feeling cold, they're having muscle ache everywhere, they're just not well, they become very cranky. They keep on crying and crying and crying. So they can't sleep. they can't eat, they can't drink. So that further dampens their immune system. So I always talk about sleeping very important. No, drinking, getting nutrients also very important. So the reason for them the reason for us to give a fever medication is actually reduce the fever so that they feel more comfortable. Then when they feel more comfortable, they can eat something, they can do something, and yeah. So when is the time that we are so worried about number one, if there is infection into the brain. So if the infection has gone to the brain, causing meningitis or causing encephalitis, that is that we are worried about. Now, of course, when this happens, the fever will be very high. But you can just rely on fever alone. But just want to remind that when there's an infection in your brain already, your child will not behave like normal. You see, there's when the infection is in your brain already, then that causes behavioral changes. So your child will either be cranky all the time, despite the fever has come down already, still very cranky, still refuses to eat, just keep on crying. Means that it's not something that's normal, right? You would expect that after I give fever medication to the child, the fever comes down, the child sort of like feels a bit better. They sort of like can rest a bit, can eat a bit. Sometimes they might even play a little bit. But if you're having meningitis or encephalitis, the infection in the brain, your child will not behave like that. They will be cranky all the time, or the opposite, they will be sleeping all the time. They'll be not active. They'll be sleeping all the time, refusing to sleep. So if you're having a child who is having fever, feeding, after fever medication, the fever comes down and it's actually running around, playing. So rest assured that no infection in the brain. So this is actually very important, a very important sign because despite the fever goes up to 40, but when it comes down, it actually the child is actually well. So it's actually a reassuring sign that we can give a little bit more time. The child is actually fighting the infection and he's doing well. We might not need to intervene by giving antibiotics or anything yet. Just support him with hydration and good nutrition food. Give some vitamin C. So give a bit of time and see. But say if
so that means,
you were saying.
So that means there are certain cases whereby you don't really have to rush to the doctor immediately as when your child is having slight fever or slight cough and cold, because you can what do you call it just now, the remedies that we spoke about, and then also from your explanation about fever can actually
if you're having a fever of 40 in the middle of the night, like 2-3 a.m. in the morning, actually that's really not a reason that you have to rush to the ER or rush to see the doctor. Because I know you can see the doctor the next morning to get a pediatrician to have a look. But you don't have to rush in that period of time. You just give fever medication first. Look at how your child is. If a child is crying, after a while, fever comes down, then he started to rest, he's breathing fine, then that's okay. Give a little bit more time. In the morning, then you see me. So that's why I keep telling parents the degree of fever. I would like to know how high is the fever, but that doesn't mean that it's very, very serious. It's what is more important is the child. If your child is actually unwell, if your fever is 37.6, but your child is the whole day, not eating, not drinking, not eating urine, that is even more worrying than if you are having a high fever but your child is very active. That's what I'm trying to do. Fever is what we need to still look at the child. Another thing is you're saying?
There's no vaccination for respiratory diseases lah. Such a very difficult to pronounce. There's no vaccination for these infections.
There is actually.
The
infection, the most common cause of infection of bacteria causing infection is actually Streptococcus pneumonia, which is the pneumococcal vaccine, which is very important. It has been in most countries have actually in their immunization program. Malaysia this year are going to put it in. We don't know when yet, but the KKM has already announced that it's going to put in. So there are a few bacteria and viruses that commonly causes respiratory infection that can be vaccinated. So pneumococcal is one. Then of course influenza. Everyone knows now that influenza there is vaccine. So these are things that we can do to protect our child from getting infection.
I see. So those can help as well. Okay. We've got a question here. Sorry, from Muhammad Nasrul Sharif. His question is, hi doctor, what's the difference between asthma and normal cough?
Well, normal cough, I mean, it's like what we have discussed just now. Any an infection causing respiratory any infection leading to upper respiratory infection, you get cough. So cough is a symptom. So the cough can be due to infection. It can also due to allergy. So that if you have asthma, you can have cough as well. But how do we differentiate these two? Now, asthma, as I said just now, it is because your airway is sensitive and it's recurrent. So every time that when there is a trigger to the infection, to the airway, such as cold air, such as smoke, such as dust, or exercise or infection, all these things actually can cause the airway to be sensitive and constrict. So if it happens many times, every time when it's raining, it's cold, then they start coughing. So these are symptoms of asthma. Whereas if it's a normal cough, it's infection, the infection is there all the time. So you will see the child coughing throughout the whole day. So I always ask the parents that when you're talking about cough, how is the pattern of the cough? Is the cough throughout the whole day? Is the cough at night and early morning only? Or is it always triggered by something? So if you can see that, it's always cold, when it's at night, when it's raining, then it starts coughing. Then that's a sign that the airway is sensitive. It might be asthma. So, but if it's just cough throughout the whole day, you give after 1 week it goes away completely, then that's not asthma.
Okay. Okay, we've got another question here from Miss Cecilia Chong. Her question is, what makes, oh goodness me, these questions. The question is, okay, the term. Maybe you can pronounce it
very technical.
What makes, I get so nervous when I have to pronounce these long terminologies. What makes bronchopneumonia different from pneumonia?
Bronchopneumonia is a subtype of pneumonia. Now, pneumonia is every sort of pneumonia comes under the group of pneumonia. You have bronchopneumonia, which is the more common one. It affects the bronchus, which means the airway, and you can have lobar pneumonia. Lobar pneumonia means there are different lobes in your lungs, so it only affects one lobe. That's called lobar pneumonia. So to answer to that question is that bronchopneumonia is a type of pneumonia. So bronchopneumonia is more common than lobar pneumonia or any other sort of pneumonia. So that it's slightly different if you're talking about lobar pneumonia. The duration of antibiotics might be a little bit different. The causative agent is a bit more different.
Right. Okay, doctor, regarding the criteria, much earlier when you were mentioning that this tends to happen or can easily happen among children that is in school, because obviously they've got to interact. So during this time, especially with the pandemic going around, right? What can you advise parents whose children are in kindergarten, especially? Because how can they protect their children, or how can they teach their children to protect themselves so they can avoid, of course, COVID is one thing, but so that they can avoid themselves getting infected from this?
I think the new norm now would be, everyone is very used to wearing masks. So if you're going to school, I think the school teachers and the parents have to really emphasize to teach your child what is the correct way of wearing a mask, and what is, when you wear a mask, children tend to touch your face. So it's not comfortable. Your face, you touch your mask, then after that you touch everywhere, then you touch your face again. So, and your mask is here. So very importantly is to teach them about wearing a mask, about social distancing, and also about washing their hands. So there's to wear a mask, you have to have a certain sort of the child must understand and must cooperate. If they're pulling off the mask, and she's nothing more harm than actually. So if you're going back to the kindergarten, then it will be very important for them to actually know how to wear a mask properly. Not to touch the mask, and then to wash their hands and sanitize their hand. I'm sure most of the kindergartens are doing it very strictly now. And also of course to get enough nutrient and also enough well balanced diet. If you're getting a well balanced diet, then you will get enough nutrient. So fruits, vegetables, proteins, all are very important. So work hard on getting your child to eat a very healthy diet.
Okay, I think among older children, it's easier to explain to them, but when it comes to younger children, for example, they're 2 to 3 years old, I guess parents don't have a choice but to let them remain at home rather than go out so that they can monitor.
Yes,
Because I know that my sorry, say again.
that might be a better choice for the very, very young ones.
Yeah, for the young ones, like my granddaughter, she's 2 years old, and she keeps touching her face. She does know that she needs to put on a mask because everyone else is using a mask, lah. So she sees that she's okay with using a mask. But then after that, she'll be touching the face, touching the nose, touching the eyes. I get very nervous lah when I see that.
Yes.
But there's only a certain extent that parents can make the effort. But,
another thing is maybe if you can fetch your own kids from the school rather than for them carpooling together, because that would further increase the risk of a very confined area. If they're not well, the chances of getting transmitting diseases is also higher.
Right. Okay. And I've got let's just see. There's one question here, but just trying to see if I can shorten the question because it's quite long. Okay, I don't think this has anything to do with the topic, so I think we're just going to skip that. Okay, Dr. Kenneth, thank you so much for your time. Is there anything else that you would like to add, or maybe a piece of advice before we close off the show to parents, especially because I know apart from the patient, parents, it's very, very distressing for them to see a child. Although this is common, but a child who cannot breathe, who is hard to feed, sometimes I see, and not just I see like me, I myself, so I can remember when I was young, I actually cried when I saw my baby. The nurse was, this small tube. I don't know. Yeah, that's very scary lah.
Yeah,
it's a small child.
Do that actually, but a lot of times when they are very young and they are having phlegm, full of phlegm in their lungs, you have no choice but to help them a bit, because very young they can't cough it out themselves, so you have to help them a bit. So I think that the thing for parents and the current situation is that you need to know when to bring your child to see a doctor. So of course, normal cough runniness, you want to observe a few days at home, that's fine. Giving some supportive medication, that's fine. But I always tell parents that if your cough is persisting more than 2 weeks, or at any point of time you see fast breathing. Now, fast breathing is never normal. Fast breathing at 3, I just now mentioned 3 a.m. in the morning, temperature 14, no need to come to ER first, take medication first, watch your child, okay, go. But 3 a.m. in the morning, you see your child is having fast breathing, you rush to ER. Because fast breathing is normal and you really need to do something about it. So if your child is not getting better, fever more than 5 days, cough more than 2 weeks, or at any point of time having fast breathing, or at any point of time not feeding well, not passing enough urine, the diapers are dry, and the child is getting more and more not active, then do come and see a doctor. There's a sign that the child is not coping well already.
Okay. Thank you so much. I think that was a very productive discussion. All the information, I think that's. I hope parents have tuned in, and if you have missed the earlier part of this show, you can always come back to Columbia Facebook, and it will be waiting for you there, because I think there's abundance of information that could really help all parents when they have a child who's in this situation. So that's all the time that we have today. Thank you again to Dr. Kenneth Looi, pediatrician from Columbia Asia Hospital, Cheras.
Yes,
hopefully we can meet you again. We can talk about other childhood infections.
Yes.